Now we are going to see the Jatene procedure. So this is a procedure to correct the transposition of the great vessels. In summary, this is when we have that the aorta comes from the right ventricle instead of the left ventricle, and the pulmonary artery comes from the left ventricle instead of the right ventricle. So first, before we see this procedure, we are going to review the normal anatomy. So here we have the heart. This is left atrium, right ventricle, right ventricle. We have the pulmonary artery coming from the right ventricle. This is the pulmonary artery. And we have the aorta coming from the left ventricle. So, in normal anatomy, we have deoxygenated blood coming from the superior vena cava and the inferior vena cava. This passes through the right atrium. Then the blood passes from the right atrium to the right ventricle. This is through the tricuspid valve. Then through the pulmonary valve. This deoxygenated blood passes through the pulmonary artery. Then this blood goes to the lungs, and in the lungs the blood gets oxygenated. Then that blood returns to the left atrium via the pulmonary veins. This is oxygenated blood. This blood passes through from the left atrium to the left ventricle through the mitral valve, and then this blood passes through the aortic valve to the aorta, and all this is oxygenated blood, and from here it goes to all the systemic circulation. Also remember that here we have the coronary arteries arising from the aorta. So this is normal anatomy. Now we are going to review what is the blood circulation when we have transposition of the great vessels. So here we have the heart. So we have left atrium, left ventricle, right ventricle. And here the issue is that we have an incomplete formation or a weird formation of the septum, the spiral septum that separates the aorta from the pulmonary artery. So instead of that, when the septum is forming, gives like a spiral formation or a spiral shape, it's just like a straightforward septum. And this ends with the result of having the pulmonary artery arising from the left ventricle. In fact, I'm going to draw the pulmonary artery in other color. So this is the pulmonary artery coming from the left ventricle, and this is the aorta coming from the right ventricle. So here we have two separated circuits. We have blood, the oxygenated blood passing through the right atrium and then to the left ventricle. and then this blood, this deoxygenated blood, passes through the aorta and goes to the systemic circulation. Also remember that from the aorta we have the coronary arteries. So all the systemic circulation is receiving deoxygenated blood, and the other circuit is we have blood returning from the lung, that is oxygenated blood. This blood passes through the left atrium, then left ventricle, and then passes through this great vessel, which is the pulmonary artery, and this is oxygenated blood, and then this blood goes again to the lungs. So all this is one circuit, which is oxygenated blood, and all this is other circuit, which is the oxygenated blood, and this blood goes to the systemic circulation. So the only way for a patient with this congenital heart disease to survive, there is a need to connect this circuit with this circuit, which could be a communication with ventricles, or a communication between the atriums, or patent ductus arteriosus. But right now we are not going to review exactly those communications. So here we are going to review how we can fix these two separated circuits to get close to normal heart anatomy. So that is the Jatene procedures. So now that we review how is separated one circuit from another, what we want to do is basically what is the defect, which is that the aorta comes from the left ventricle and that the pulmonary artery comes from the right ventricle. So to do this, first step is we are going to do a transverse incision of the aorta. So this is a transverse incision from the aorta, transverse incision, and we are going to remove the ostia of the coronary arteries. So from here are arising the coronary arteries. So we are going to cut we do a cut from the side where the coronary arteries are arising to separate the coronary arteries from the trunk or the proximal aorta. Then we're going to connect these coronary arteries to here, but we'll see that later. So here first we do this transverse section of the aorta. This left us with a distal aorta and a proximal aorta. I'm going to draw it in another color, so proximal aorta stays in green, light green, and distal aorta is dark green. And still this the aorta has deoxygenated blood. Next step is we do the same both in the pulmonary artery, so a transverse cut or a transverse incision of the pulmonary artery. So here at the same level we do a transverse cut. And now I'm going to separate the color of the proximal pulmonary artery and the distal pulmonary artery. So all the pulmonary artery has oxygenated blood. Proximal pulmonary artery, I still leave it with orange color, and distal pulmonary artery goes in let me see if I have purple. Now next step is, now we have a cut here, and separate the coronary arteries from the proximal aorta. Now we are going to suture the coronary arteries to the proximal pulmonary artery. So this, instead of arising from the proximal aorta, are going to arise from here, from the proximal pulmonary artery. So we do an anastomosis of the coronary arteries to the proximal pulmonary artery. And also we are going to repair the site where we cut the coronary arteries. It's not exactly at this moment, but this site is going to be repaired. We cannot have a hole here. So step 1, we do this transposition and we cut the ostia of the coronary artery. Step 2, we do a transverse incision of the pulmonary artery. Step 3, we do this anastomosis. So now we have the coronary arteries arising from the proximal pulmonary artery. Step 4, we are going to bring the distal pulmonary artery, and we are going to bring it in the anterior portion of the heart. So here we have the aorta, and here we have the pulmonary artery. So the distal pulmonary artery, remember that here we have a cut. So the distal pulmonary artery is going to pass here to an anterior position relative to the aorta. So this is the distal portion of the pulmonary artery. So I'm going to pass it in an anterior position. So it is like this. So this is the distal part of the pulmonary artery. Remember, here we did the cut. Now the distal part of the pulmonary artery is anterior to the aorta. And next step, step 5. Step 5. Now we are going to anastomose the distal part of the aorta to the proximal part of the pulmonary artery. So this, the distal part of the aorta, is going to be connected. This is the distal part of the aorta. This is the proximal part of the pulmonary artery, and these are going to anastomose. So here we have the cut. The aorta is anastomose. The distal aorta is anastomose to the proximal pulmonary artery. So now here we have what was the proximal pulmonary artery still receives oxygenated blood, and now here that we have the anastomosis with the distal aorta. Now the distal aorta receives oxygenated blood, and this oxygenated blood goes to the systemic circulation. And also remember that we anastomose the coronary arteries to the proximal pulmonary arteries, so also the coronary arteries are now receiving oxygenated blood. And next step, now we are going to anastomose the proximal aorta with the distal pulmonary artery. So here is the distal pulmonary artery, and is going to anastomose here with the proximal aorta. And now, so the blood coming from the right ventricle passes through this, that was the proximal aorta. This is the oxygenated blood, and then this blood passes to the distal pulmonary artery, or what was the distal pulmonary artery, and this is the oxygenated blood. This blood goes to the lungs and get oxygenated, and then the blood returns with oxygen to the left atrium. And next step, we repair the holes that we left in the ostia of the coronary arteries, and this is, we close these holes with a pericardium patch, or it could be a synthetic material. And so now we have pretty much the same, we have the same circulation as a normal heart. Like, the only difference is that, of course, we still have a communication between left and right. This is the communication between the ventricles, or the communication between the atriums, or the patent ductus arteriosus, which we can cut. So we also need to correct the initial communication between the two circuits that we already mentioned, that for a patient to survive with the transposition of great vessels, it has to have. So we also need to repair that. And also the difference between now this repair heart and this heart is that here we have the proximal pulmonary artery is to the right of the proximal aorta, and then the aorta is to the right of the distal pulmonary artery. Here we have the proximal aorta, the proximal pulmonary artery is to the right of the proximal proximal aorta, or what is like the proximal aorta, because now this, that was the proximal pulmonary artery, now function as the proximal aorta, and this that was the proximal aorta now function as the proximal pulmonary artery. Here, this is the distal aorta that was connected here, and this is the distal pulmonary artery. So here we have the proximal, or what now function as the proximal pulmonary artery, but that initially was the proximal aorta, is to the right of what now function as the proximal aorta, what originally was the proximal pulmonary artery. And here in the distal part, the distal pulmonary artery is to the right of the aorta, which is the other way around here, but now the pulmonary artery is connected to the right side and the aorta is connected to the left side. So this is the Jatene procedure to correct the transposition of the great vessels, and this ends with the heart like I just mentioned it before, like this. So we have blood coming from the superior and inferior vena cava. This is oxygenated blood, passes to the right atrium, then passes to the right ventricle, then passes through what was the proximal aorta, but now function as the proximal pulmonary artery, and passes to the distal pulmonary artery. Then the blood gets oxygenated, and the blood returns oxygenated through the pulmonary veins, then passes to the left atrium, then passes to the left ventricle, and then passes through the proximal, or what was the proximal pulmonary artery, but now function as the proximal aorta. Here now we have the coronary arteries, and then we have the aorta, the distal aorta. So the only difference is that now here all the pulmonary artery, or what function as the pulmonary artery, is to the right of all the aorta, or what function as the aorta, instead of here, that here first the pulmonary artery is to the right, and then the distal aorta is to the right. And also here we have some patches of pericardia. And remember that we also need to correct the communication between the two circuits that we mentioned before.